So we're going to start with the call on heterogeneous health data, followed by the innovative decision support system for neurodegenerative diseases afterwards, and the others we will do after lunch. So can I just invite the people who are going to be presenting a pitch from the first call, so that's the one on heterogeneous health data, to at least make your way to the front of the room. So that's Susanna del Signore, who is already here, Carole Maignan, Jan Wekemans, Christian Muehlendyck, Liesbet Peeters, Serdar Sultanoglu, Philippe Cleuziat, and Dominik Geller. If you can just make your way to the front so you're ready to step up rapidly when your name is called. But I think we are now ready to start. So Susanna, over to you if you want to go over to the podium and give your presentation. And the clock should be on 3 minutes.
So, good morning to everyone. My name is Susanna del Signore. I'm the founder and CEO of BLUECOMPANION, France. BLUECOMPANION is a SME specialized in the design, development, and implementation of web-based health data platform. A key point is the integration of clinical data from different sources. And we work in order to enable collaborative research projects. Our first operational focus is to generate high-quality data. BLUECOMPANION environment works in a GDPR-compliant situation. We are also compliant with key international standards for clinical trial. Our server is based in the EU, so the data stay in the EU. Our second focus, I would say the companion focus, is about to use novel technologies in order to enable patients to more directly contribute to generate clinical data and to push this data in a clinical trial or e-registry. In which way? Via unintrusive connected devices in order to monitor continuously health data and be able to intervene or anyway to store this data for further analysis, and via specialized friendly interface like last time with humanoid robots. So the name of 3 projects we contributed in the past, or we are still contributing now. We have Sprint, a first IMI geriatric project with a regulatory deliverable, the validation of the methodology at the European Medicine Agency. And then I would like to remember GeroCovid. It is an electronic registry that allows to follow more than 6,000 older persons during the pandemic. And finally, Scotty is a collaborative project using Pepper, a humanoid robot, in order to speak with the patient, get answers to specific questions, standardized questions, and push these questions in electronic case report form. We are interested in call 1, the core pathways in neurodegenerative disease, the topic 1, and the topic 4 about the integration of new, different heterogeneous data in health care platform, in health data platform. Thank you for your attention.
Thank you very much. And that was precisely 3 minutes, so thank you, and everyone else take note. The standard has been set. So next up is Carole Maignan from the University of Venice. Carole.
Hello, good afternoon, good morning. Yes, my name is Carole Maignan. I'm a research facilitator at the University of Venice, Ca' Foscari. I'm here obviously representing a whole university, but in particular I will represent 2 areas of research that we are very eager to promote here. Is obviously the area of computer science and bioinformatics. We are interested in the the call 1 and topic 4, access and integration to heterogeneous health data, but also on the call 2, the topic on cardiovascular disease, for example. But I will explain now what our expertise is. So we have a group, our group has a very long-standing expertise in computational intelligence. For example, neural networks, evolutionary computation, swarm intelligence, and fuzzy reasoning. We can use all this to build interpretable and explainable artificial intelligence models. We have experience in biomedical modeling and simulation and can develop prescriptive algorithms giving the optimal course of action to some desired outcomes. So you have understood that we can contribute to algorithms and skills for modeling, especially using a machine learning approach. We are looking for partners to collaborate with who want to cooperate on developing decision support systems based on computational intelligence in the clinical environment. We already developed a PRIN project. For those who are Italian, they will know that is a national funded program. And we have international connection that would be very eager to join any consortium. In particular, in the USA, in the Netherlands, in Italy, obviously, and in the UK. Why our involvement can be an advantage, apart from the fact that we are based in Venice. We can take data from multiple data sets or experiments, create complex models, and investigate different what-if scenarios that would suggest optimal actions, maximizing or minimizing some objectives, so get to an optimal treatment. I think this can apply not only to this topic, but also to other topics. I'm here all day, very happy to give you some precisions about the multitude of journal papers in computational systems we published on bioinformatics and related topics. If I may have a few seconds left, yes. I would like also to speak about another group of experts who are working on biotherapeutics and biomolecular engineering that are interested in the other topics, the next generation imaging and personalized oncology. I think you would be interested to know that we have recently developed a biotechnological platform for discovery and engineering of biomolecules. And this is very relevant for today's meeting.
Okay.
Thank you very much.
Thank you. Okay, and next up, Jan Wekemans from Intersystems. Is Jan Wekemans here? Okay, then we will go on to the next one, Christian Muehlendyck from J&J.
Good morning, everyone. Christian Muehlendyck from Johnson & Johnson. I'm really excited to be here today to introduce you to a consortium that we are planning to run and drive forward. It's IDERA. IDERA stands for Integration of Intelligent Data and Evidence Towards Regulatory Acceptance. Thereby, IDERA will drive a very unique approach, as we believe, because one of the underlying problems with all the data around innovative digital health and AI tools, as well as medical devices, such data is so far not accepted by authorities, neither from a regulatory perspective nor from an HTA perspective. Hence, we plan to work very closely together with those authorities in order to make this data accepted and applicable, thereby enabling and accelerating patient access to innovation, but also enabling, as a second part within this approach, access for industry and researchers to this data. That's the first part. The second part of the project is really going to be about developing a data space to meaningfully connect already available and novel patient data from diverse sources based on federated principles to have in-depth patient information on both anytime the patient is looking into the data, but also from a patient pathway perspective, because we believe this will enable a win-win-win situation for everyone associated to it, for the patient or citizen itself, associated with the applicable tools, for the healthcare providers to enable better decision making, but also then for researchers in order to have novel approaches that can be taken forward on that data. For this, we plan to leverage existing EU data approaches like IMI project, but also develop methodologies and acquiring and analyzing data such as PROMs, PREMs, medical devices, genomic, imaging, and digital application data in a GDPR-compliant way and aligned with the planned EHDS framework. To ensure the applicability and sustainability of the approach, this will be verified and tested on focused use cases around lung cancer, because we believe lung cancer is an ideal disease to look into it. It's one of the most severe diseases we have. It's extremely deadly, and there are multiple players involved in it, hence making the data really siloed. And we believe bringing this together will really enable better decision making. And also it will offer, lung cancer is associated very personalized treatment opportunities that can be accelerated from that aspect. Hence, we believe this approach is not only unique to lung cancer, but we really see IDERA much more as an accelerator and catalyst that can be leveraged and used as the basis. From a consortium perspective, J&J will drive IDERA together with Philippe, and we believe this actually leads to a unique and optimal partnership bundling world-leading farm, med device, and medtech expertise with experience on long-term experience with public-private partnerships, in-depth expertise in regulatory and HTA work, evidence generation and patient pathways, as well as imaging and digital platform management. We work closely together with other farm companies, and we are connecting with SMEs around patient consent, data homogenization, patient feedback capturing, and AI analysis. And together we are now looking for additional partners from your side around academic organizations with high level of data analytics expertise, healthcare providers and hospital networks with expertise in and data on lung cancer and patient pathway management. Very importantly, patient organizations, health authorities such as regulators and HTA bodies, but also industry stakeholders from Medtech and pharma companies with relevant IMI projects. So I'm really looking forward to connect and to drive this important and cross-sectoral opportunity to move healthcare forward together. Thanks a lot.
Thank you. Okay, I'm just quickly checking Jan Wekemans. Is Jan in the room? Nope, still no sign of Jan. Okay, then we move on to the next person, Liesbet Peeters from the University of Hasselt.
So my dream is that one day every single person gets the treatment they deserve in a timely manner. I am convinced that data saves lives, so you will see me with my badge everywhere I go championing the movement #DataSavesLives. My research group focuses on developing new methods to handle and analyze real-world health data. So my name is Liesbet Peeters, and I'm an assistant professor at Hasselt University in Belgium. Through my network, I'm connected to several relevant health data initiatives, like, for example, eBrains, Elixir, Gaia-X, Eden, and the Odyssey community. The results generated within 2 flagship projects I am currently leading would be leveraged to an IHI project proposal. I am the chair of the Multiple Sclerosis Data Alliance, or MSDA. The MSDA is a global, multi-stakeholder, non-for-profit collaboration that aims to overcome the sociological and technical challenges that arise when scaling up real-world data in the field of multiple sclerosis, or MS. Since our launch in 2019, we have developed a metadata catalog with metadata from over 40 registries across 5 continents. This then being now the largest federated network in the field of multiple sclerosis. Next to this, we have developed a federated infrastructure to support large-scale collaborative efforts. This infrastructure was used within the COVID-19 in MS Global Data Sharing Initiative. This initiative generated data-driven insights to address urgent questions related to the effect of COVID-19 in people with MS. Within a few months, we managed to set up a global data sharing initiative, aggregating data from more than 20 data sources across the globe. This delivered then insights that were used to update the global advice for people with MS before the summer of 2020. And this global advice was translated into more than 15 different languages, illustrating the wide dissemination of our work across the globe. I am also the use case lead of the use case multiple sclerosis within the Flanders AI research program, which is a large program in the region of Flanders that is impulse funding artificial intelligence. Currently, a team of AI experts that consists of 40 researchers, including professors, postdocs, and PhD students across 4 different Flemish universities, are focusing on developing cutting-edge AI technologies to overcome some technical challenges related to real-world data handling and analysis. Examples of challenges that the team is currently tackling is coping with bias related to federated learning across heterogeneous real-world datasets, AI tools to speed up data integration, data wrangling, and data visualization of multidimensional longitudinal data sources, coping with missingness in trajectories, and increasing interpretability of predictions of decision support systems. So together with these go-to partners, I am looking for other people interested in topic 1 or topic 4.
Great. Thank you very much. Okay, we have another person now, Roubini Tsakri from Lifebit. Okay?
Hello everyone, happy to be here today. I'm Roubini Tsakri from Lifebit, and I'm Strategic Account Manager. So we live in a world where we are generating a vast amount, tremendous amount of data today, and this is absolutely fundamental for precision medicine and drug discovery. The good news is that there are above 200 plus organizations that generating this biomedical data today, and the bad news is that 97% of this data are inaccessible, unusable, and are standing still, basically. So this is because of the regulatory restrictions that each country has, and of course, it's not feasible anymore to transfer this data around. Lifebit are genomic and precision medicine specialists, and we are working with the largest flagship initiatives all around the world, such as Genomics England in the UK, the Danish National Genome Center in Denmark, and Hong Kong Genome Institute in Hong Kong, among others. So we have developed a newer technology, which is called federated technology. What this means is that we bring the technology, the analysis where the data resides, without moving, copying, or transferring the data. So we do not upload or download anything, and that way the data stays secure in their own environment. Our federated platform is now enabling more than 270K researchers worldwide secure access to biomedical data of patients with disease of high unmet public health needs. So federation not only guarantees the ability to provide safe and secure access, but also allows analysis over distributed cohort worldwide. In addition, we work with pharmaceutical companies such as Boehringer Ingelheim, Janssen Oncology, and AstraZeneca to help them gain secure access to biomedical data to develop more precise drugs faster. Today, we are here for topic 4, and we're seeking to network and build a consortium for access and integration of heterogeneous health data. And we are also seeking for partners with access to biomedical data among a variety of unmet disease areas, rare disease, cancer. And then we are also here to find partners, researchers. We are seeking for researchers or pharma companies to support and drive projects which will provide impact in these disease areas. Thank you for your attention.
Thank you. And next up is Serdar Sultanoglu.
Hello, my name is Serdar Sultanoglu. I am R&D Director of ForteArGe. ForteArGe is an R&D performing SME from Turkey. We are specialized in AI, digital twin, and computer vision technologies. Today, I will present you our project idea, AI to Move, and try to uncover some collaboration opportunities. In this project, we target the problem of immobility, which is a major and continuously growing threat to the public health. And prevalence of immobility-related disorders is very high in an aging society. And in many countries, the number of individuals needing a medical attention exceeds the capacity of conventional healthcare system. Modern technologies like smart wearables and AI are promising, but in real life they are underrepresented in clinical practices. Therefore, a significant part of the society and healthcare ecosystem needs a solution for this unmet public health problem. Our project, AI to Move, will develop an open platform for immobility disorders, focusing exploitation of wearable device data. One of the main innovations of the platform will be being open and standards-based, to be collaborative and interoperable. And the other innovation area will be hosting and developing novel AI technologies like self-supervised learning to extract value from unlabeled and large data sets, and federated learning to address the issue of GDPR-friendly data analysis while ensuring high performance, and multimodal machine learning to take the advantage of supportive data in different modalities like sensor data, video data, or other types of clinical data. And the last innovation area will be development of consumer or clinical grade wearable devices. Currently, we've been working on setting up the core consortium and shaping the project idea with them. Now on technology side, we have one university from Germany and 4 companies from Turkey, Spain, and Germany. On clinical side, we have Hacettepe University from Turkey with us, which brings a use case on sarcopenia diagnosis and management by using wearable devices. Now we are looking for partners in technological and clinical domains, regardless of their type. They can be universities, SMEs, or large companies. But especially we are looking for a coordinator, preferably with a successful history in this kind of programs. And that's all. Thanks for listening, and please contact me if you are interested in our project idea.
Thank you. Someone else who was on exactly 3 minutes, so well done. I'm just judging you on how well you stick to time. The rest of you should be judging, of course, on the content. But I'm the moderator, so I'm interested in that. Next up, Philippe Cleuziat.
Good morning. So my name is Philippe Cleuziat. I work at bioMérieux in the Open Innovation and Partnership Department. I'm really pleased to be here. bioMérieux is a world leader in terms of in vitro diagnostics, and we provide products and services in the field of infectious disease. We are already contributing to several IMI projects. Today, we are interested in the topic access and integration of heterogeneous health data for improved healthcare in disease areas of high unmet public health needs. The context of our project is antimicrobial resistance. As you know, it's a slow pandemic and worldwide threat with more than 1.7 million deaths a year. And it's putting at risk medicine with the lack of antimicrobials which are efficient. We look today for a consortium to set up a prototype platform in order to allow near real-time surveillance of antimicrobial resistance. It's a unique project of its kind, we believe. Dynamic surveillance of bacterial pathogens and resistance characteristics are essential for infection prevention and control. This platform that we aim at would constantly collect and analyze data generated daily by laboratories from patient samples routine testing. It would allow to track pathogen circulation, focusing on resistance rates, with a dynamic geographical tracing at national, local, international, or regional level. It could also integrate information related to patient profiles, including antibiotic consumption. To achieve this, we must define methods, standards compliant with regulations to ensure data collection, transfer, analysis from systems in clinical laboratories and hospitals. Dynamic dashboards, together with artificial intelligence tools, would allow enhanced local antibiograms for optimal empiric prescriptions of drugs, and also alert on emergence of new resistances. bioMérieux may be the coordinator of that project or not. It's open. We look for various partners, pharma, diagnostic companies, SMEs, academia, regulatory bodies, and so on, to access and analyze routine data, solve technical challenges related to capture, interoperability, storage, and analysis. We also need partners to address all ethical and regulatory aspects, including data privacy and cybersecurity. Together with public authorities, objectives and governance models of the platform should be addressed in order to provide relevant information to all potential users. So I thank you for your attention, and I'll be really pleased to connect today with most of you. Thank you.
Thank you. Another one on the 3 minutes, so which is very good because, as we learned earlier, you have to be very concise when you do your proposals. So the people who've used their time wisely maybe would be good at writing proposals too. Next up, Dominik Geller.
Good afternoon, everyone. My name is Dominik Geller. Hygiaso AG is a small startup delivering and developing a platform for patient-centric data sharing. We are proposing under the call 1, and I'm delivering this pitch here on behalf of Sean Estudel from LabCorp, who unfortunately can't be here today. She's attending remotely. Both of us are obviously accessible for any subsequent discussions and joining discussions, of course, in our consortium. Other members with whom we are discussing shaping this call include companies like AbbVie, Sanofi, Pfizer, Siemens Healthineers, and we are still open to receive other participants to this consortium. Notably, a coordinator could be welcomed as well as partners from industry, academia, and small entities as well, who are willing and able to contribute to this. Our ambition is to develop a smartphone application that allows every individual to receive and hold their own personal health data from the various healthcare service providers that hold that data today. They can then, from their device, consent to data requests that are put forward to them and agree to share for whatever purpose with whom they see fit. With this channel, we expect that we can provide access to patients as well as access to real-world data 10 to 100 times cheaper and faster than compared to a traditional channel today. That platform should also be open for third-party services and devices that can be connected to that platform, and obviously those services could be offered to the individuals that utilize the platform. A very open platform as such, which is provider agnostic from the data side as well as on the service provider side. As such, we are open to partners to the consortium that come from the data holder side, pharma or healthcare provider, as well as device companies, be they disease management services, be they prognostic or predictive devices, diagnostics devices as such, that help us to establish an initial and sustainable patient population on that platform so that this can actually be sustained beyond the project life. The disease areas where we focus to initially, obviously, the platform will be disease agnostic, but we need to establish an initial population. We'll do that on 2 diseases, asthma and IBD, for the reasons of having a high public health burden, as well as a evidently high individual patient burden. Both of these diseases are chronic and require disease management, hence ample opportunity for those additional services and devices in order to improve disease management, support the patients in disease management, hopefully also with services that help to improve the prognosis, possibly allowing for interference with the disease as well, changing the outcome.
Your time is up, I'm afraid. If you want to finish your sentence, go ahead. But
I'll finish the sentence in terms that from all those sectors you can reach out. We are currently planning to or discussing whether we focus on also expanding the asthma case to lung diseases more broadly, including COPD and lung cancer, and look at that as the continuum disease in order to improve the progression of those diseases. Thank you. I'll close here. You can reach out afterwards. Thank you.